interested in living fibril network? Like, what's the start when you start?
The start for me is very simple. I am a reconstructive surgeon, so my job during 40 years has been to repair human, and mainly for hand surgery. And it's very difficult to repair tendon, to repair flexor tendon. It's a huge problem because you have to rebuild the sliding system. And at the beginning of my experience, I have used a technical procedure imagined by an American surgeon just after the Second World War. It was a procedure using two surgical steps, and using only a plain graft of a tendon. And patients were off of work during at least 6-8 months. Wow. That's too long. And the result were very poor. So one day I decided to find something else, to find another solution. And I have been interested in the sliding of the tissue. How is it sliding? And I had a very simple question. Look, you move your fingers. Inside your hand, the tendon is moving 3 centimeters. The tendon, in order to obtain flexion, is moving up 3 centimeters. You don't see the skin moving. The skin is not moving. So there is an absorbing system for the sliding. So I decide to study this sliding system. And little by little, I use new technologies. First, microscope, then the first endoscope we had, then mono CCD camera, then 3 CCD cameras, then new endoscope, and contact, very close contact endoscope. So little by little, I have tried to improve the technology, to improve the results of the images, and to understand. And little by little, I discover a new world for me. It was a new world because I had no learned at the university how things are sliding in the body. Nobody was able to teach you how is it working, except using concept made 1 century ago by former anatomists, and speaking about virtual spaces. Virtual spaces, nobody knows what is a virtual space, or some layers. You know, it's like a hamburger with layers sliding, that you say, yes, it's sliding layers, I can accept, but how can you explaining the nerve continuity, the lymphatic continuity, the venous continuity, the arterial continuity, if you have separate layers? You can't explain that. So, when you are making anatomy and microanatomy, you are confronted to the reality of the tissue. And you have to accept, to think depending on what you see, and not to think the best way that you understand. You have to be conform to what you see. So, little by little, I have seen that fibers were moving, lengthening, sliding, dividing, and slowly I understood that this was really the mechanical behavior of the fibers. And so I decided to use this new technology to have good images, because if you want to prove now, you need to show. If you don't show, but we can show now, we have the technology to show. When I am looking to some colleague with old diapositive, black and white, how can you accept that? Now we have video, we have colors, we can do a lot of things to show, to explain. So we need to have good images with video, with good colors, good light. We need good quality to explain, that's all, to explain. First to explain to me, and then to explain to the others. This is what, there is a very famous German philosopher, Kant. You know Kant? And it's approaching the truth. If you have the truth, or you think you have the truth, first you have to show it to the others. And then you have to wait their answer after their own experience. But if everybody is agreeing with you, maybe you are near the truth. Maybe. But it's the only way. You have to show, and people have to say, yes, we agree with you, or we don't agree. But if you don't agree, you have to say why. And then you have to give another explanation. It's not enough to say, I don't agree. It's very easy to say, I don't agree. Yeah. But no. In science, you have to say, no, I don't agree, for this reason, and I propose another solution. This is science. This is the sharing the knowledge. But it's not only to say, I don't. No. I refuse this way of thinking in science.